also, in case I get stuck in between, please do not leave. I'll come back because of the internet issue here. It can give you issues in between. So just keep me, even Yashashvi, you are there, no? So just let me know if I'm getting stuck or somewhere. So just remind me of that, okay?
Yes, yes, sure.
Okay, I'll share my screen, guys. Okay, before that, actually, I want to understand how many of you all know about gut microbiome. Like, we chose this topic. I will give you the recording, but please don't be like, कि यार ये recording मिलने वाला, so I'll run away and then I'll come back and watch it. Don't do that mistake because question and answers will not be addressed in that. And also, when you see the recording, I'm sure you're just missing out on a lot of important things. So yes, I will share the recording, but also make notes. Make notes as much as you can. Okay, it'll really help you. Now, before that, I want to understand, before I share the screen, I want to know how many of you all know about microbiome? What is leaky gut? Can you tell me about leaky gut? What is leaky gut by any chance? If anybody can tell me, what is leaky gut? Anybody can unmute, can tell me also. No problem.
When the gut is unable to absorb the nutrients, whatever we are eating, it is not being absorbed and fully digested as well.
Okay.
And that is one of the symptoms that we can understand it's a leaky gut.
Okay. Okay. What else? Anybody else has any idea about leaky gut? Because everywhere on social media, people are talking about it. Even gut microbiome, by any chance, if you understand that, because it will be good to debunk all the things. Any of you have heard the word leaky gut and gut microbiome also, how important it is? Yes or no? Quick, guys. Quickly. Don't feel hesitant also, please. It's a private affair, so nothing is to be. Yes.
Shikha,
Yeah, go ahead.
the tight junctions of the gut, which is the villi, the gaps get created in it, because of which unwanted substances that are not supposed to be passed into the bloodstream are then able to pass through, which starts creating all the problems. Also, like the other person said, there are problems in absorption, and then the toxins also enter the bloodstream because of this leaky gut situation.
Okay. And what about microbiome? Any idea about that? What is microbiome? What is the microbiome's job? Where is it?
So the microbiome is in the colon. It's a colony of different bacteria, viruses, fungi, pathogens that all live together. And if they are in, it should be in a balance. Like,
Yeah.
if there is imbalance, then there, we have dysbiosis, and all the other problems start happening because of this. So there should be perfect harmony, like a balance of good and bad bacteria both.
Good. Okay. So yes, you gave a good idea about microbiome, but leaky gut, this is what everyone knows, that it's just the holes and it's just parted apart, and that's what is causing the leakiness. So it's very much more complex than that. It's not as simple as just, take a glutamine powder and things will be fine. It's not as simple. That's why I wanted to do this kind of a webinar today, where I will go much deeper into, of course, not like academic way, but whatever everyone can understand. Till that level, I will be explaining things to you all. Okay. So we will talk in detail about each of the things and how it affects your gut health as well as your hormones. Because everyone has gut issues and hormonal issues, is what we see, right? So why are we talking about this particular thing only? Because there's a very strong correlation between the two. So that is why it is very important for us to understand the mechanism and the science behind it, so that you can work on it accordingly and you're not falling prey to some random supplements here and there which you see on social media. Okay, so we'll get started now. All right, and like I said, be very responsive. Give me the emoji so that I understand, because when I share the screen, I can't see the chat immediately. So please give me the thumbs up and heart or whatever. Okay, that's like easy for everyone. All right, so I hope everybody can see the screen. Give me an emoji again. Back. Everyone can see the screen? Yes or no?
Yes.
Or is it that when I share the screen, I'm not able to see the emojis? I'm not sure. Okay. Okay, so let's get started. So we are going to understand the microbiome in a deeper way, and what is this ecosystem, and what is this entire thing, which is probably not considered in the medicine, modern medicine, but in functional medicine now we have started discovering this in a very deeper manner. In fact, it was much before that it was existing, but I think it's got the limelight now. So we are going to understand more this in detail, and also why I chose this topic. Okay, so three important things that you should expect from this webinar. Okay, one is that why gut healing protocol often fails. Okay, like understand why supplements like probiotic, glutamine, bone broth not always works, and the missing microbiome ecosystem that actually drives the gut repair. We are going to talk about that. Okay, the real structure of the gut barrier is what we are going to understand today. Learn how the microbiome, mucin layer, immune cells, and epithelial junctions work together to protect the body and prevent the inflammation from the main toxin, which we are going to talk about, the LPS entering in the blood circulation. Now, please don't be overwhelmed with these words. I will make you understand each of them one by one. So I understand everybody is not nutritionists here. A few of them could be, but please don't worry. I'll simplify the things with the diagrams and everything. Don't worry about that. Okay. And also, third thing, how to rebuild a resilient microbiome is what we are going to see. So discover the role of keystone microbiome, diet diversity, and microbiome metabolism, also how it works on improving your hormones and gut health, overall well-being in general. Okay, even for the metabolism. So all those of you who are struggling to even lose weight, this is one of the things that you will get your answers from. Okay. So in my clinical practice, as if you have, if you're here for the first time, I am a qualified nutritionist who has also done my post-graduation. So when I did this program, I mean to say my college, I was like a traditional nutritionist. I failed many times in giving results to my patients. That's because it's very limited and it's very standard for everyone as a traditional nutritionist. But as in when I failed and failed and failed, I would not even blame myself for failing. It was the lack of knowledge and the kind of information that is given to us in the college. I was doing that, and I constantly kept thinking that why this patient didn't get results, why this patient didn't get results, why did that it worked for somebody else but not for this patient. So I had so many questions and queries in my head that because of that I could just crack and decode all the answers, and finally I've reached here. I'm pretty sure there is much more that I have to learn, but this is where I have landed today, and I am so happy to solve so many complex cases and understand the main root cause of these medical issues, where it is coming from. So this is what it has helped me to reach here. So my mission is very clear. I have to help people globally to also, heal, understand their root cause, addressing the long-standing issues that they have, especially for the gut and the hormones, by using the functional medicine and the microbiome clinical science. Okay. So I definitely want all of you in the community to get maximum information, which is in the right way. And through the research that I read, I want that information to go to all of you guys. Okay, so keep attending, and you will learn a lot from me. Okay, through whatever I learn, I will inform all of you guys about that. Okay, so let's understand, why do people fail in getting the results even after trying everything? Like, okay. So many people today feel that they have tried everything. They will try clean diets, they will try supplements. Like, seriously, when I see my patients for the pre-consultations, not even in the program, like when I do a pre-consultation, I see them knowing everything. Like they are taking every damn thing, like they know everything. So in spite of that, they are consulting me because there is definitely something going wrong and something is not changing, right? In spite of doing everything. So they are doing their clean diets and supplements and gut healing protocols. I see a lot of people also running, gut cleanse programs and a lot of programs where it is like, oh, you eliminate this, and everything will start working for you. But what after that? So everything is like a question mark. Elimination diet and probiotics. And I'm not blaming them. I was one of them before. So That is why that question kept me going, that why is it that you have to be in a restrictive way of doing the things? Why the healing is not coming as like, why there is no robust health that somebody can just tolerate any and everything, right? So that question kept me going, and which is why I kept learning. So yet the symptoms persisted, and they still feel bloated and hormonal imbalance, fatigue and thyroid dysfunction, skin issues, metabolic problems. And the reason is very simple. Most interventions focus on the symptoms or the single pathway. That is one big problem. Okay, so health is regulated by an ecosystem. Okay, so microbiome, gut barrier, everything, like together it works. We have to see that as a whole picture, not just one individual thing in a row. Okay, so what exactly is microbiome? So I think some of you, I think one of you, I'm not saying the word. Some Paul was there. What was the name? I forgot. So she mentioned it rightly, that it is a beautiful, a club of bacteria, viruses, fungi. All the microbiomes live together in harmony. So if you realize, by nature, by default, we have this goods and bad. Everything works together. It's never like only good is there, or only bad is there. If there is good, there is bad also. So there's a beautiful harmony of goods and bad bacteria, or whatever you say. Together, it lives in our gut. Okay, so we don't think it's only in the colon, it's also overall body. So we have on different places different microbiomes. Okay, so it all live together, and you all have to know one thing is that these microbiomes also have their own genetics. Okay, they have their own genetics to produce certain chemicals, which is keeping you in the survival mode also. So it's not just your genetic code, but also their genetics, which is producing the certain kind of chemicals, which is also allowing that rigidness and longevity that you say. Okay, so a harmony in microbiome is very important for this reason, because our livelihood comes from there also, majorly coming from there actually. So that is why in functional medicine we also say microbiome is also a parallel organ. It is not just living, it's also a parallel organ, because the genetics of the microbiome is also working for us, okay, and keeping our health intact. Okay, so together they form a complex ecosystem that interacts with our metabolism, immune system and hormones. It is basically functioning us. Okay, so in fact microbiome cells in the body are roughly equal to the number of human cells, highlighting how deeply our biology is connected to these organisms. So it is very important to have a good balance of microbiome. Okay, so where does the microbiome come from? Kahan se aa raha hai? Okay, so this is a short way of making you understand, thanks to the AI, that it can create such beautiful pictures now. So of course, first is the birth, the way we are born. So it's vaginal birth or C-section. Is it the breast milk or is it the formula feeding? Like especially the breast milk is what is going to give us more beneficial bacteria. Vaginal birth is going to give the better colonies of microbiome. Environment, caregivers and pets and soil and nature. Diet, food choices, antibiotic use, sleep and stress. We are also going to see the disruptors, why people see that they have such poor gut microbiome. So we have to go back to the history. What was your mode of birth? How was your childhood? Did you take too many antibiotics? Were you on formula feeding? How was your environment? Was it too sterile? Like you were cleaning too much and you did not expose yourself with the dust or the dirt. Okay, so your resilience of microbiome and the diversity depends completely on the exposure that is given to you, or the destructors that is given to you. Okay, so we are going to see that more in detail. So where do we have microbiome in the body? Let's understand. So I think she also said that it is only in the colon. It's not true. It's not just there. So in the mouth and the oral cavity, we have it there. We have it on the skin. There is a beautiful skin microbiome, which many people are still not aware of. This microbiome, if it is imbalanced and the barrier is broken, such people will be more prone to eczema, psoriasis, and other stuff. Okay, so even the skin microbiome plays a very important role, not just the gut microbiome. Okay, so in fact, in US, there are studies which are also these people are doing on the skin microbiome. So there are lots of serums that are coming up, very new. Like I think there's only one brand that is making. I don't remember the name of that. They are making this skin microbiome solutions, which is healing the eczema and everything for the children and for the adults also. So in fact, there is a research which is also going on where they say that if you have a poor gut microbiome of the skin, it can also connect to Alzheimer's. Okay, it's like it's a wide thing. So what I'm trying to understand here is that every microbiome is affecting something or the other in our body. So it is a beautiful harmony, like I said. It's not like one step is causing the second step. It's not like that. It's a complex thing. Urinary tract has this beautiful harmony. That's why people who have imbalance of that will have urinary tract infections very easily, right? Respiratory tract, vaginal microbiome. So these are all the things together, which is, keeping us, like I said, keeping our health intact. Okay. So it's different microbiome, but what we are specifically talking today is about the gut microbiome, not the other ones. The oral one I want to specifically say is very, very important because that's where the gut actually starts from. So it is important to understand that if the microbiome of your mouth is not healthy, okay, it will start giving issues in the gut eventually. Also, I want to make you all understand is that if your microbiome on the skin is also not good, okay, it can allow any kind of pathogen to enter even through the skin, because our skin is the largest organ. Okay, so it can enter, and through the respiratory tract, it can enter in the gut and survive very easily. So there are people who can get parasite infection even through the skin. So you don't have to think about like, oh my God, do I have to protect myself? No, you don't have to do that. What we are talking today is about how to create that beautiful harmony in the microbiome that you have, so that your resilience and your tolerance improves and your body can, survive any kind of pathogenic overgrowth very easily. It doesn't really matter to the body. Okay, so we are going to talk about that. So why the microbiome matters for longevity? Let's understand that. Okay. Microbiome is not just about the digestion. Okay. So there, like I said, there are so many things that it is doing together. So it is also for the metabolic and the immune. It's primarily for the metabolic and the immune system, that it is giving us, like I said, that immunity and everything is going to be dependent on the genetics of the microbiome. So please listen to me very quickly. I'll make you understand one by one what I'm actually talking in detail about the immune cell and everything. Okay. So research now links that microbiome health is doing the immune regulation. Okay. So immunity regulation happens majorly because of the microbiome. So people with autoimmune conditions, food sensitivities, one food is intolerant, the other food is also intolerant. I'm the living example of that. I have lived like that before. As many of you who have attended my webinar before, I had this issue, right? So immune regulation issues will come in if your microbiome is not good. Inflammation is affected, is all controlled because of the microbiome. We'll see how is that inflammation happening. So we'll understand, oh, when you see your CRP, ESR is constantly high, why it is not improving? We'll understand that. Metabolic health. So people who are struggling to lose weight, constantly doing everything, doing like every damn thing, taking all the supplements, still not losing weight. Why is that? We'll understand that. Hormonal imbalance, why the estrogen is like, becoming high again and again, why the PCOS symptoms are not improving, why the insulin resistance is not improving. We'll understand that. Why the thyroid is also not improving. We'll understand that. Brain health, anxiety and depression and all of that. Brain health also in terms of, even I would say, brain fog and poor attention span, shorter attention span. These are all the things that can be related to your gut microbiome. Aging and longevity also, because the better your microbiome health, the better will be your resilience to tolerate more things. So your improvement of health will definitely be seen. That is why people in villages, you will see will eat every damn thing, but still not get such metabolic or other issues as compared to the people who are living in a very sterile environment from the childhood times. You'll see in US, I live in US, so I know that all the ads that I see is of either cancer, of allergies, cold and cough, and autoimmune conditions. It is so sad to see that. But on the other hand, because in India we are also living like a modern lifestyle, and the kind of food that we eat has also changed. The soil quality has changed. So even here, there are a lot of people who are getting these kind of issues. But people who live in villages versus, or even in US, people who live near the nature and are exposed to the rural kind of environment, they will have a robust health as compared to people who are living in cities and having a sterile environment. So all those things are also going to affect your longevity and aging process. Okay. So microbiome produce key components such as short chain fatty acid, neurotransmitter precursors, vitamins, immune signal molecules. I will make you all understand each and everything in detail properly. Okay. So don't worry about these fancy big words, which is overwhelming. So when microbiome balance is lost, the body shifts towards the chronic inflammation and the metabolic dysfunction, which accelerates the disease and aging. In short, when the microbiome is not, it's imbalance, the chronic inflammation happens, metabolic, like all these medical issues that you have written can come in, and disease and aging can become like a normal thing. The microbiome starts shaping health from birth, like I said. It all depends, like if you have had a C-section or vaginal birth, antibiotic exposure, formula, or breastfeeding, childhood exposure, antibiotic use, diet quality, environmental microbes, modern lifestyle factors like ultra processed food and sugar and too much of fatty foods and chronic stress, poor sleep, pesticides, poor soil quality. I'm again and again mentioning about the soil because one of the major disruptor is also the soil that is not good anymore, and that is why that our ancestors used to have that one apple. Now we have to almost eat like 7 apples to get the same amount of nutrition. It's that bad. That is why the use of supplements comes in. Okay, so medications such as PPIs and antibiotics, I can't really emphasize enough on this. People are literally popping pills like anything, even in their daily routines. You get headache, you take a medicine. You get something, you take an antibiotics. If you have acidity, take an antacid. It's like a norm, and it's an easy thing to. It's become like a lifestyle thing only. So taking each medication that you take has an effect on your microbiome big time. So these are big disruptors. So that is why taking a history of the patient becomes very important for us. Like I said, what was the way that you were born? What kind of exposure did you have as a child? What kind of food diversity that you had as a child? Did you have a course of antibiotics? Were you depressed? Were you stressed? Did you have loss of some loved ones and you felt bad about it, and breakups or anything? Every damn thing is going to be in that history taking for me is very important, so that I can connect the dots and understand that, oh, this person's microbiome has definitely been compromised, so I definitely need to work on that for this patient. So the history becomes very important. And so when you have the loss of beneficial microbiome, or even the overgrowth of the beneficial microbiome, so it is not always that you will lose the good bacteria. Even if it is overgrown is a problem. So like I said, it has a balance of everything. Anything too much or too less, everyone knows is not good. Similarly, even for the microbiome, if it is too less or if it is overgrown, it creates a problem. This state is going to give inflammation and the dysbiosis. How the inflammation is occurred, I will tell you, but this is a state called dysbiosis. Okay, everyone understood till now whatever I am saying? Give me yes in the chat. I think I'm not able to see the emojis. I don't know if you guys are giving me emojis also or not. Yes. I'll move forward. Only 2 of you have said. Tell me, everyone say yes. Everyone understood? Okay. Now let's move forward. So understanding the gut repair. it's not just the leaky gut. Please understand that. It's not as simple as that you had tight junctions and then it just started, breaking and then everything started leaking there. It's not that simple. Okay. There are many layers, and I'm just going to talk about the main layers because otherwise it will become like an academic lecture for all of you. So there are few layers which we are going to talk today. Okay, so there is microbiome layer, there's mucin layer, there's immune signaling layer, there is epithelial tight junctions. When these layers communicate properly, harmful molecules never reach the bloodstream. So we'll understand one by one. So there's a picture that I've created. Okay. Okay, let's first understand what is this actually. It's too complex to understand. Everybody can see me, right, on one corner of your screen. Yes or no? Yes. Okay. So please know this. Okay, this is how the colon looks like. Like colon means your small intestine, large intestine. Like it's like a pipe, right? Everyone knows that. It's like a pipe. Now inside that pipe, okay, this is that inside that pipe. So this picture is inside. So this is inside that pipe. Okay. So this is called lumen. Okay. Yahan pe the food will go. Okay. Now on top of this, there is this microbiome, the harmony of that good and bad. So good, gram positive, gram negative is what we commonly say. Okay. So all that bacteria are here. Okay. And then there is this mucin layer. It's a mucin layer. You can think of it like a transparent gel kind of a thing. Okay. Transparent gel that is there, which is keeping it like, not allowing any pathogen to enter very easily. Now, because here is the bloodstream. Here is the bloodstream. Okay. This is where the food goes in. Here is the microbiome. There is this transparent gel. Okay. On top of it, there is another immunity, like immune cells are there. Immune cells, I'll tell you why it is there. Then there is this villi. Okay. Immune cells. And then this is the epithelial junction where it is going to keep it intact. And then again, there is this bloodstream, and then outside is the immune cells. So let's understand each of them one by one. Okay. So when you eat the food, okay, or anything that enters in this lumen, this microbiome it's going to allow only the things which is important for you to enter in the bloodstream, which is not important, it will not allow. Okay. So this has a beautiful way of understanding that this is good for you and this is not good for you. Okay. This mucin layer, like I said, is creating a barrier. It is not allowing anything to enter very easily. Okay. How is this mucin layer formed? मतलब वो बनता कैसे है? वो thickness जो है, वो जो mucus है, वो बनता कैसे है? It happens, it is made by a lot of things, but one of the main thing that it forms is because of the butyrate. Butyrate मतलब ये जो bacteria हैं, good bacteria, it produces something called as butyrate. It eats up the fiber from the food, which is important for it to survive. वो उसका खाना है. It's a prebiotic. It will eat up the fiber. It will become nice and fat and healthy, and it will produce butyrate. And this butyrate is one of the key factors to keep this cushion, that is that mucus line, healthy. Okay? It's a barrier. Then यहाँ पे एक immune cell होता है, एक layer होता है. Okay? This immune cell is basically secretory IgA. यहाँ पे देखो, यहाँ पे लिखा है मैंने. Secretory IgA. It is amazing to actually keep anything that can enter from that mucin by any chance. This secretory IgA is just going to work on it, kill it, and then it will not allow it to enter very easily. Okay. So secretory IgA is one of the thing. This is also called as IPA, intestinal alkaline phosphatase. I'm not going to be like sounding like an academic person, which is also going to keep that, bad thing to enter not easily. Like it's not possible for anything to enter here very easily. Okay. So there is a microbiome layer. That means good bacteria and whatever we need. And then there's a mucin layer, okay, which is going to keep the things like, not letting it inside. And then there is this immune cell function that is very important. Then comes the epithelial wall, okay, this. Yahan pe there is tight junctions, okay. Actually, tight junctions yahan nahi hota hai, tight junctions yahan hota hai. ये जो finger like projections hai na, ये finger like projection, yahan pe tight junction hota hai. There's a tight junction here. And नीचे वाला जो ये वाला जो part है, it has something called as, what is it? I forgot the name of that. Yeah, it is called adherence. I don't know how to pronounce it, but it keeps it flexible. वो उसको flexibility के लिए रखता है. ऊपर ही सिर्फ tight junction होता है. यहाँ पे नीचे it is that flexibility के लिए adherence that is there. Okay, and नीचे यहाँ पे, so that it is not moving, there is this desmosomes which keeps it like a filament. It's stitched together. It stitches together. So when people say tight break हो गया, it's not easy to break, कि ऊपर से break हो गया, filament break हो गया, नीचे का भी सब break हो गया. It doesn't work like that. It's not that easy to break it. Okay, so it gives that motility, so that any food is coming, it can move easily, because the paracelsus movement is also very important, right? So that's how complicated the things. And in इसके अंदर भी जो blood stream जा रहा है, उसके अंदर भी immune cells होता है, by any chance if there is any kind of leaking happening. So this is how the entire अंदर का barrier looks like. It's not like just simple break and then anything entering very easily. Everyone has understood the basics that I have tried to simplify in a way for all of you.
Can you just elaborate a little on the immune defense part, like after the mucin barrier, the butyrate is formed, and then
So there is something called, so there are two things there, but I will specifically say to remember one thing right now is secretory IgA. Okay, that is very, very important to not let any kind of toxin enter in the epithelial wall. So it will fight it there itself. What is the job of immunity? Immune cells. Okay, it will just fight anything that is not good for you. Correct? So what it is doing is, body has beautiful layers of it, so that it does not allow anything to enter in the bloodstream for any infection. So it has that immune cell right there, so that it is not entering in the epithelial wall. So this secretory IgA is one of them, which is going to keep it intact, and it is not letting the any kind of infection to enter in the epithelial wall. Did you understand this much? Everyone understood? Now I'll tell you why that is important and how the other issues start coming in. I'm going to connect it to the hormones and other things. You can unmute, all of you, if you have understood things or not. Yes or no? Have I made it clear?
Yes.
Perfect. Only one person understood?
Yes.
Everyone understood, right? Okay. Now, let's understand what happens when you all say that these are the medical issues that you have. Okay. Now, please understand, if at all, your microbiome has become good ones, which are important ones, has become less. Okay. Now, the bad ones are going to find a space for it to outgrow very easily. Okay. Or even if it is overgrown, it is going to create a problem. Okay. Even the good ones, which is overgrown. Let's understand, this kind of imbalance is going to affect this mucin layer, because it is the byproduct of the things that it is producing. Like I said, butyrate wo bana raha hai continuously. Wo fiber khata hai, it makes the butyrate and makes a beautiful thick lining of that mucus. Now, when this imbalance is there, the mucus is less thicker. Okay. Now, because of this, the bad bacteria that possibly is actually making something called as, like, think of it like toxins. Okay, it is making some toxic thing which is called as LPS, lipopolysaccharide. It makes LPS, and this LPS was already made before. It was also formed before. Like, it's not that only after it was damaged. But because the mucin layer was good, the good bacteria was good, the LPS was not entering in the epithelial wall by any chance. But now, because the good ones have been compromised, the butyrate production is compromised, this mucin layer becomes thinner, and this secretory IgA, which I said that immune cell is constantly fighting the LPS, constantly fighting, constantly fighting, constantly fighting. Sometimes the secretory IgA is exhausted because of that. Okay, exhausted means it becomes low. The immune cells become low. Okay, now this LPS can start damaging the epithelial walls. Okay, this epithelial wall can get damaged. So then like I said, that upar ka junction, if it is damaging too much and the barrier, this thickness is gone, like it's really diminished, and the immunity is exhausted, that's when it will start affecting the junctions after a lot of time. Okay. And complete breakage is not very easy. It takes a lot, many years to create that kind of a damage. Okay. And this can enter the bloodstream. Now, even if that little effect on the mucin layer, and also if it is entering here also, this LPS can give a systemic inflammation. What do you mean by inflammation? That the immune system is constantly fighting it, because body has made by nature LPS ke liye, there is a very sophisticated way to not allow it to enter. So like I said, there's secretory IgA, there is also called as intestinal alkaline phosphatase, just for that LPS to not enter. So LPS becomes a very important toxic thing that needs to be controlled. And this is one of the primary factors why people will have inflammation, why people will have, gut issues. They will come up with autoimmune conditions. They will come up with low immunity. I see that on the regular basis in my one-on-ones. That is what I'm telling you. So this is one of the primary factors why somebody has, so many health conditions for that matter. Now, somebody who's just trying to fix this with the glutamine, okay, and not fixing the steps of it properly, doesn't get the result properly. Are you getting, everyone? I hope it makes sense. I'm going to go deeper into this, but I hope everyone has understood what is the role of LPS. Did you understand that? LPS is nothing but the toxins that is released from the negative, gram-negative. That means the bad bacteria. It can enter only if your mucus layer is thin and your immune system is also exhausted. Now it has now started damaging the epithelial wall. Have you understood this? Unmute and tell me, or write it in the chat, please. I'll go ahead then. Hello, am I there? Hello.
Yes.
Please unmute yourself and tell me yes or no. Everyone has understood, because I don't see people. Oh yeah, people have. Everyone understood this, right? Okay.
Yes.
Because only 2-3 people are responding, so I don't know. Okay. All right. So layer 1. So we'll understand each of them again. Okay. So it's a protective layer, or is the microbiome ecosystem itself. So beneficial microbiome prevents the pathogens. That means the bad, anything which is bad, like fungal overgrowth, or parasite by any chance, H. pylori overgrowth. So H. pylori is a different thing. We are mainly talking about the small intestine and large intestine here. Okay. So any pathogen overgrowth by competing for nutrients, producing antimicrobial compounds. Okay, so what it does is also, like I said, butyrate it is making, which is making that thick mucus lining. It is also antimicrobial, Antimicrobial matlab, it is making compounds which will not allow the bad ones to survive there. वो खुद ही destroy कर देता है उसको. Okay, so that is also antimicrobial. Butyrate is particularly important because it fuels the intestinal cells, strengthens the gut barrier, reduces inflammation. Butyrate is very, 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 very important. Please understand this, because I will make you understand why the people are not getting results when it comes to improving their health. Is one of this factor. This butyrate production is not there because the beneficial bacteria are only not there, which is why the butyrate can be very low. and the patient doesn't see any improvement. Okay, so that is why remember the butyrate part, please. Second is the mucin layer. So above the intestinal cells lies the gel-like mucin layer. Like I said, the mucus layer separates the microbiome from the intestinal lining. Okay, healthy bacteria live within the mucus layer. Okay, but they do not penetrate beyond that. Okay, it doesn't go beyond that. It doesn't go lower. When the mucin production decreases or the mucus degradation happens, it increases the bacteria moving closer to the epithelial cells. So even if it is bad one, it is entering there, right? So inflammation will increase. Suddenly the immune system is triggered. Then the barrier integrity weakens. Okay. Third layer, immune communication. So please understand, immune system and the microbiome, everything is connecting and communicating with each other. It is like that. It is never like this happens, this happens. It is constantly communicating. So the gut contains nearly 70% of the immune cells, body's immune cells. So the immune system constantly communicates with the microbiome. Okay, one of the most important molecule, like I said, of immune system is the secretory IgA. I do advanced testings for this in my patients in the GI map also. I see this secretory IgA, and I have seen this as exhausted for many people. They will not have leaky gut, but they will have low secretory IgA. That means their immune system is exhausted. So definitely the mucin layer has also got affected. So I have to work on the microbiome. I have to work on the mucin layer. I have to work on the immune cells. For me, leaky gut is not very important because that is anyways intact. So zonulin is another thing that we check to check if you have leaky gut. So this is a very important marker for me, for somebody who is working on their gut health, or even for that matter, hormonal health. Okay, so we check the secretory IgA because it binds the pathogen, it prevents the microbial attachment, and maintains the microbial balance. So low secretory IgA can allow the pathogens to expand. So people with low secretory IgA, I see the bad ones which are very high. Maybe fungal overgrowth is there, H. pylori is there, and then I see parasite. If it is too high, that means the body doesn't have the capacity now, no immune system to fight against it anymore. So the immune system has become weak to fight against it because body has beautiful way of eradicating these things on its own. It's not that in the olden times people used to not get pathogens. They used to, but their microbiome was so good, their mucin layer was so good that it did not need a way to have an antimicrobial kind of a thing. Okay, so this is a very, very important thing when it comes to even autoimmune conditions, when it comes to even tolerance of the food. I've seen people having intolerance with so many things. Like I said, I was one of them. I am one of them. I'm still working on this. So one food intolerance, then the second intolerance, then the third intolerance with the food, then the fourth. If you come up with more intolerances, that means your secretory IgA has also got exhausted. So immune system has become weaker. Okay, so this is a very important marker. LPS, like I said, is the toxin that is derived from the harmful bacteria. Okay, so this LPS, when it is too much and it is entering, it's a component coming from the gram negative, means you can think of it like the bad bacteria. Okay, it starts affecting when it starts entering the bloodstream. This is where the inflammation increases. The cells will produce a lot of fight against it, which creates an inflammation in the system. Okay, and this becomes like a systemic thing because it's constantly going, and the immune system is constantly fighting. And then people are like, my inflammation, I'm doing an anti-inflammatory diet, I am doing gluten-free, dairy-free, I'm doing anti-inflammatory, but it still doesn't work. Why? Because you have still not worked on that mucin layer, the microbiome, the LPS control is not happening, the secretory IgA is very low. So immune cells are still exhausted, which is why it becomes very important to treat that as the main factor. Okay, so systemic inflammation, insulin resistance, metabolic disease, hormonal imbalance. This is the condition known as metabolic endotoxemia. If you are from this science field, you can understand this, but it's fine. Like, think of it like toxins. Okay, how the body normally blocks this. Okay, like I said, there is something called as intestinal alkaline phosphatase. वो इम्यून सेल्स जो बताया था ना मैंने, सेक्रेटरी आईजीए जहाँ पे है, the same place this is also there. It is going to detox this, like these advanced, there are these advanced testing that is coming up, which can probably give us this marker also eventually. But even secretory IgA is good. So I don't want to get into the detail of this because you will get confused. Okay, so chuck this. So microbiome also regulates hormones. Now, how does it regulate the hormone? That good microbiome balance now, it is also important for conversion of T4 to T3. Have you heard me before where I say the conversion of the T4 and T3 happens in the gut, So what does that conversion do? Like, where is that happening? It's through the microbiome. So if your gut microbiome is compromised, and your mucin layer is compromised, and your secretory IgA is compromised, and your epithelial junctions now have broken by any chance, the LPS is entering and then you get autoimmune thyroid issue. Okay, so it is all coming from there. So if you have thyroid issue, but if you're not able to convert your T4 to T3 in the active form, and microbiomes are not good, like I said, the immune cells are not functioning properly, these are the things which will not allow your thyroid to improve. Okay, that is one thing. Second, there is estrogen, which will reverse back more into the bloodstream because the microbiome was not good. So beta glucuronidase activity increases too much. So the reflux, so the estrogen gets eliminated out through stools. But if your microbiome are not good and the activity of increasing the estrogen, increases in the blood, the absorption increases in the blood of estrogen, you will eventually come up with issues like estrogen dominance. Okay, so imbalance in the estrogen and progesterone causing like PCOS and all the fibroid and endometriosis, and so many health issues starts coming in because of the estrogen buildup, and also blocking the thyroid. Estrogen dominant patients also will have thyroid issues, by the way. Okay, so these are the problems that keeps coming up when the microbiome again is imbalanced. So that is again coming from there. So please remember this. Estrogen dominance comes from microbiome imbalance only, and the thyroid conversion happens there, because I don't want to sound, like I said, academic teacher. So cortisol, please know this: if your microbiome is exhausted and your immune system is also exhausted for some reason, of course there is a lot of inflammation going on. So body naturally, even if you do not have mental stress, it is constantly under stress, so the cortisol also increases. So like I said, everybody not necessarily have mental issues of stress, or maybe it is not that they have some problem in life. Even if they have systemic inflammation, that can also keep your cortisol high, and stress response also. So then you become insulin resistant and this and that. So it becomes like one to second and third and fourth, everything is interconnected. So gut inflammation activates the HPA axis, which is your stress response, and increases the cortisol. Okay. And then you will have PCOS. The PCOS patients will see that cortisol is high. Thyroid patient will see HPA axis is affected. Autoimmune conditions. So all that is affected because of the microbiome. So the keystone, I hope this much you have understood. Then I will talk about what are the important microbiomes which are important for your gut. I'll just give names of it so that you understand.
Yes.
Understood? Only my assistant has understood, nobody else. Give me yes or no, guys, please, quick. I want everyone to participate, okay? Not two people, just two people. What about others? Okay, let's go ahead. So keystone microbes. Keystone microbes means the ones which were producing that, butyrate and acetate and propionate for the mucin layer, and something which is important for your metabolism also. Okay, so let's understand 3-4 of them I'm going to talk about. There are too many things in this, but I'm just going to talk about the keystone. That means the important ones. Okay, so keystone microbiomes are the organisms that maintain ecosystem stability and support the gut barrier and the immune system and the metabolism. So one is the Faecalibacterium, a very complicated names. Pritznesi is the name of this. This is a butyrate producing microbiome. Very, very important. I see this very low in the GMAP for my patients. acromencia. I can't emphasize. I think I've spoken in a few of the stories also on my Instagram about this. People who suffer from metabolic issues, especially, they're not able to lose weight. They constantly keep trying. They are doing every damn thing to improve their health, but still no improvement. This is the reason why the acromencia can be very low, which is the microbiome which is important for the for the metabolism to be good. Okay, if it is compromised, people will struggle to lose weight. Bifidobacteria, very important. Bifidobacterium species. Okay, species means there are many types of it. One of so together. Okay, it's very important for the immune tolerance. It produces short chain fatty acids and improves the gut colonization. In short, it is important. Okay. Rosberria, very important again. Ruminococcus brommi is very important. Provetella is very important lactobacillus species. So these are the primary ones. So please understand, these are the things which are like friends, you know. One will produce butyrate, it will give the butyrate to another one, and then the other one will increase, and it works together. So when you're feeding one, it can feed this also, and this also, and this also. So it's a harmonious thing. Sometimes this can be low, but this can be good. So this is also doing the compensation work for that. So it is a harmonious way of living together. That is what is called as redundancy. Okay. So these microbiomes are very important for that mucin layer. Please understand that. Okay. And for the immune function to be in good balance. So when we do the GI map testing, I don't know if, I think there are one or two people who are new here. I'll show you the GI map. In that, we see these microbiomes very importantly. And I definitely, I'm more interested in understanding these two ones because that is primary focus there. There are many more advanced testings which are available, but unfortunately not available in India if you are from here. But in US, there are some tests which just are done on the microbiomes. Okay. So in that, we can understand more in detail. But through the GI map, at least these ones, we can understand if it is really low, that means, oh, the patient doesn't have enough butyrate. So that is why the mucin layer is affected. So then I get my answers, you know. So it is very important to feed them. Now, how do you work on it? I will, of course, get into it. But these are the key ones. Okay. Modern triggers that can disrupt the gut barriers. Number one, chronic stress. Okay. If you're very, very stressed, it definitely will increase your cortisol sympathetic tone low. It will reduce your immune cell secretory IgA. Mucin layer will be affected, like I said. Slower epithelial turnover. If your circadian rhythm is disrupted, that means you're sleeping anytime, waking up anytime, no balance of your routine, it is going to alter the junction of that. So protein expression is altered because of that. And impairs the intestinal permeability. Okay. NSAIDs and alcohol, any of these medications, painkillers, headache ke liye, pain, all these things, and alcohol will damage the epithelial mitochondria. That means the cells of that. Okay. Emulsifiers. Okay. A lot of you, if you're thinking I'm having a protein bar and if there is an emulsifier, please know that it is not doing any good because that fiber is of no use. Can you all hear me? I was on mute by mistake. Can you all hear me?
Yes.
Yes, right? Okay, good. So emulsifiers. So like I said, if on the packet it is written emulsifiers, of course it's not as bad as the medicines like painkillers and other stuff and alcohol, but even emulsifiers are really not doing any good, honestly speaking. So if you think that you can grab a protein bar when you're on the go instead of taking a pizza or anything, I'm not saying that it is the best choice to have than pizza only, but that protein bar is also not doing any good to you if there is emulsifier there. Okay, so broad spectrum antibiotics. Okay, like I said, is of course going to affect the butyrate production of these, like good bacteria are also destroyed, right? So that is also one problem. Also, if you're taking too many antimicrobials like berberine, berberine is still okay, it can feed some of the good bacteria. But if you're constantly taking too many antimicrobial like neem खाते जा रहे हो और ginger clove वाला खाते जा रहे हो, garlic खाते, and so many antimicrobials if you're taking is also be affecting your diversity somewhere down the line. Okay, so please understand that you have to be very careful in taking antimicrobials and antibiotics. Take antimicrobials, but in a limited way under someone, and also work on the resilience of these microbiomes. Very, very important. Western diet, I would say it's very low in fiber, very fatty, like fried chicken, right? So that also can allow the entrance of the LPS very, very easily. Why? Because LPS is also fat. Okay, it can enter just like the other fats in the bloodstream very easily because it can't differentiate. And if your immune system is exhausted, then worse, right? So in India, we by default, because majority of us, even if we are non-vegetarians, are by default having enough fiber, but it's still not enough for the fermentation to happen. Like I said, I'll tell you about that. Okay, and early life factors also really matters, like C-section born, formula feeding. Are you taking like over sanitization? Is that a problem? Like, is it what you're giving that to your child? Like constantly you are, not allowing your child to expose to other different kind of things. That's why I make it a point that for your children, you are giving exposure to different kinds of environments, and take them out. Outdoor activities are very important. Different environments are very important. Exposure with the animals also in the very early age is very important. And playing in soil is also very important. So running on the grass, touching the plants, so many things. Like you have to expose yourself with the environment, also different environments. Okay. So dysbiosis is not just bad bacteria. Dysbiosis is more than the presence of pathogens. It also involves lots of good, important, beneficial microbes. Like I said, all the important ones. If there is it's loss of that, and loss of microbial function, of course. For example, loss of bifidobacteria and Echilobacterium leads to a lot of important functions will be deteriorated. Butyrates will not be formed. Immune tolerance will be there. That secretory IgA will be exhausted. Inflammation will increase. Gut barrier maintenance is not there. These functional losses then contribute to diseases like metabolic syndrome, autoimmune conditions, inflammatory bowel disease. So dysbiosis is really the loss of the microbial ecosystem function. So why the diet diversity really matters. Okay. Why we have to have a different variety of foods. Now, different variety, matlab, ek din pav bhaji, ek din sandwich, ek din bhel is not what I'm talking about. Okay. Diversity in terms of the real food, okay, which is given by the nature. That is what I'm talking about here. Okay. So microbes survive on fermenting the fibers and the nutrients. Okay, it ferments and produces the butyrate. Please understand that. So each species prefers different kind of fermentation from the different kinds of fiber. It needs different kinds of fiber. So when the diet variety is low, okay, many beneficial microbes simply starve. Even if we are eating like, at least in India, I would say people are still eating a diverse kind of a diet, but I would still say by default, even at home, we are constantly eating even a mono diet. And also I have seen that people have incorporated biscuits and breads also as a routine for them. Even if it is like a homemade food, but these are the basic things that they will generally have. Bad quality oils and the sugars that they have. Such very high carb diets is also a problem where the variation is not there. Because of that, it's not feeding the beneficial microbiomes also. Okay, so this is why the diversity is very important, because each of these bacteria are fermenting with different types of fiber coming from. Okay, so I'll talk in detail about that. So the diverse microbiome is associated with good metabolic health, strong immune resilience, and reduced inflammation. So why a single macro diet often fails? So if you're just taking high protein diet, high protein, I've seen patients, I take a lot of proteins in my diet. I've seen that with my husband, okay? He is stuck with his weight for the longest time. And I have seen him eating subah eggs, then chicken, and then some eggs again, or maybe skip the meal. I have seen him doing this. And every time he's like, why my weight doesn't go down? Why my weight doesn't go down? Okay, this is the reason behind it, because the good commensals, the good bacteria probably have gone very low. He did not eat enough variety of fiber, different types of fiber to feed it. So maybe the mucin layer has been compromised, the microbiome diversity has gone low, and the body starts now feeding that protein. Now it starts fermenting that instead of the fiber. So what it produces is ammonia and hydrogen sulfide, which is giving you gas and bloating and such kind of issues. So people with high protein diet will always come up with issues like these. I feel very heavy all day. I feel bloated all day. I have constipation. So if you're not maintaining that, then it becomes a problem itself. Okay, then high fat diet alone, like a keto kind of a diet, if you're doing, and if your gut barrier is not good by any chance, the LPS can enter very easily. So even after doing a ketogenic diet, probably you lose some weight, but you will come up with issues like, but this problem did not improve for me. Okay. Or maybe even if it is an unhealthy fat kind of a diet, like I said, typical American diet where people are just eating fried food, that becomes a problem in itself. I'm married to a Gujarati, and in my household, I have seen it's so normal to eat fried food. Like they can literally eat fried food every day. It's a normal thing for them. And even in with their meal, some fried food is always there. So it is a problem in itself. Okay. So a high fat diet not only necessarily is a keto diet, it can be like fried food, which you are eating on the regular basis. Even for that matter, if it is too much of ghee also, I would say. Okay. It's not that ghee is bad or any fat is bad. How much is the limit in that? That is very, very important. Or just the fat diet that you're taking, no fiber at all. Okay. So that becomes a problem in itself. Okay. Mono diet, same diet every day. There's no variation, and this is a problem. When I take the recall, people are, no, I do eat, but there is only certain 2-3 types of things that they are just making alterations in. It becomes a problem again. I have seen people who live abroad, like I have seen, like even for me, I would say in US, it's very easy for us to have a bulk cook kind of a thing, and we are eating like same thing day and night, day and night, day and night. There's no variation. That is a mono diet again, where people will have diversity issues, and again, food intolerances and so many other issues. I had seen one of the, I don't want to name that celebrity here, but there was one celebrity I was watching the interview of, and he said in that interview that he just eats chicken, and just one more thing he said. And he said that the minute I eat something else, I have to go to the toilet. So I have stopped doing all of that. I just want to stick to my routine, and that's how it works. So the tolerance of the food has reduced dramatically for him. Okay, so the mono diet gives such kind of issues where the microbiome diversity is not there, resilience is not there, then it becomes a problem. Okay, then how to build this robust microbiome? I think I've done all of that, and I'm pretty sure all of you have understood that. Now you want to know the real thing. Ab isko theek kaise karna hai? Okay, so let's understand that. So the true gut health requires supporting the microbiome ecosystem. Now, please understand one thing. When people have gut issues, okay, it is not as simple as just start eating fiber, all types of fiber. It's not true. People who have sensitive digestion can feel very bloated initially. They will come up with, constipation issues or diarrhea issues. If the minute I start fiber-rich food, it starts giving me issues. Of course, these are all complex things which we need testings for, where we need to understand which food primarily will work. For that reason, consulting a professional person becomes a very vital thing, because it is not something that you can do DIY. Okay, it needs a way and a system of working, trials and errors. That way it has to work. But let me give you a broad idea about what kind of things that are important here. Okay, diet diversity. When I say diet diversity, doesn't mean, like I said, one day pav bhaji, one day bread, and one day sandwich, and one day kurmura. No, I'm not talking about that. When you say different diet diversity, probably use different kind of plants and fiber coming through fruits and vegetables, and the whole wheats, whole cereals and pulses coming from there. People who have sensitive digestion, I would still say go off the gluten and the dairy for now, till the time your microbiome resilience improves. So it is not true that everyone has to become a dairy free and gluten free kind of a person. Okay, it's not true. I have one of the relatives. He has lived in kind of a village, okay, all his life. He's a primarily a basic doctor. So he like surrounded with like all the farms, a house in between, and he's a doctor and does like little bit of Ayurvedic treatment. He's like my in-laws side, one of the relatives, okay? And this guy, okay, he eats sugar daily, like in every damn food. We are Gujaratis, okay? Like my in-laws are Gujaratis. So he eats sugar like anything, like his sugar capacity is very high. His health is amazing. Absolutely no problem. Absolutely like amazing tolerance. He had COVID. He has not taken any what do you say, vaccines for that. He's against it. He is like, no, I will fix it on my own. He did not take a single medicine during COVID times. He is totally against the medications. Okay. He'll do all his natural nuskas and everything. And I've seen him doing what, every day in the morning, he'll have his licorice water. And then he will have his, garlic here and there. Then kacha aloe vera he will eat. He will walk barefoot on the grass. This is his routine. I'm seeing that from ages, and he's like, yahi karta hu main, bachpan se yahi hai mera lifestyle. And I'm seeing him eating every damn possible thing, like sugar, sugar, sugar. It doesn't affect him at all. And I used to question this always, like, why is that it is working for him and not for us? Probably. It's because that his microbiome probably is very robust, and the kind of diversity that he has kept because of the exposure that he had. And I will see him if there is a cow, no, he will always rub the cow's skin. He will touch and cuddle. He'll do all that. I've seen him doing that. And it's been almost 8 years of my marriage, and I'm seeing this from there. And he says that I'm doing this from bachpan se, I'm doing like this. So all these things, the kind of and stress, there's no stress because he's lived like that, and very small clinic, and from morning till this time only he will do it. Now he has got into farming. He has stopped that practice and got into farming. Like amazing, amazing health. So diversity, not just in terms of diet, but also in the exposure of how you give from your childhood, of course, really matters, but how you build a resilience for it. It will take time because it has been compromised, and so many factors in the past that has happened probably, which is affecting this today. So diet diversity doesn't happen like in a go. Probably just try one new food in each week. That's how you build the tolerance for it. It's not that every day you're going to have different kind of things, but one new food. So if you have like a regular cabbage, probably just do a purple cabbage one day. Okay. So if you just like, maybe you have an apple, maybe try berries someday. Okay. If you have prunes, then do cranberry or do any other thing. Like one food new trial every time you have to do to build that resilience. Okay. And the goal should be like 30 plants per week has to go. 30 plus plants have to go per week. And approximately we aim for like 30 to 40 grams of fiber per day, but it doesn't happen like that. So if you count it, like you have to grow micro levels of fiber each day, because if I suddenly give somebody 30 to 40 grams of fiber, it's going to be like, my God, like Shikha, I am constipated. I'm never going to come back to you. It's going to be like that. So it takes time, because a sudden microbiome shift you cannot do. It takes time. You have to feed the bacteria one by one. So aim for a wide variety of plant fiber and the phytonutrients, and feed the keystone microbiomes. Like I said, it is fed on different kinds of things, which I will talk about now. Okay, so support the butyrate production. You can eat resistant starch, like you can have cooked and cooled rice and potatoes. Okay, that works beautifully. If you are a diabetic, you have to strategize it in a different way. Okay, so that it doesn't spike your blood sugar. Like you have to have your right proteins and your other, no, insoluble fiber along with it, and do the resistant starch together so that it doesn't spike, and the fats also going along with it. But the resistant starch will feed these good microbiomes, which will improve your butyrate production and the fiber also in general. Okay, there are different types of fibers, but specifically resistant starch is what is going to improve the butyrate production. Okay, reduce the dysbiosis drivers that is coming from the ultra processed foods and the antibiotics and the stressors. We have to work on that. If you do not stop that and just keep feeding, it's no point. Okay, support the mucosal hair, mucosal health. Sorry, and adequate micronutrient and anti-inflammatory foods, supporting the mucous epithelial cells, improve the microbial ecology. I'll talk in detail about that. So don't simply just add, a probiotic. Don't do that by any mistake. Like, don't, your food is the first thing that is important for anyone to work on. Okay. The prebiotic, probiotic, which one to use, when to use, comes under a professional guidance only. Because if you take the wrong probiotics and if you have bacterial overgrowth in small intestine, it's a problem. Please know, the microbiome that I was talking about was the large intestine microbiome. In the small intestine, the microbiome layer is almost negligible. The mucus layer is also very thin because it's absorption. The main thing is to absorb the nutrients. That's it. So it comes in the large intestine. Okay, whatever we spoke of today. So if you're just randomly taking probiotics and if it feeds some dysbiotic gut in the small intestine, it becomes a problem in itself. So it becomes like a havoc. So don't simply just keep popping the probiotics on your own. Please don't do that mistake. So these are the pillars that is very important. So you can maybe take a screenshot or whatever you want. Okay. So feed the good microbiome, consume diverse plant fibers, include resistant starch, add polyphenol rich food. Polyphenol matlab you add a lot of colors in your meal, like you do red color things and green color things and purple color things. Do those kind of variations, but one at a time, not everything together. कि resistant starch भी खा लिया आज मैंने polyphenol भी लेगा, कल मैं constipated हो गई. Don't do that mistake, please. It has to be one at a time, once in a week. That's it. One new thing. Okay. Rotate the vegetables and fruits and legumes and herbs. Rotate it. Like, don't keep taking like one apple, one apple, one apple, one apple, one apple. I have done that mistake even as a nutritionist. I used to literally get like a mono kind of a diet before. Why? Because even I was trained like that this is one food that is going to work for you, no other food. But I realized that it's just not the right way to actually treat the patients. That why the resilience is not there for the other ones. You have to work on that. So your tolerance has to improve. So one thing at a time. Protect the mucin layer, have inadequate fiber so that your butyrate production improves. Omega-3 fatty acids coming from chia seeds and walnuts, and omega-3 capsules, very, very important. Enough vitamin A and zinc is very, very important. Make it a point that you have some nuts and seeds on daily basis. Have yellow, orange fruits and vegetables for your vitamin A. Or else you can also stick to egg yolks. Okay, that is also going to be good for your fat intake also. Okay, that is very important. Support your butyrate productions by resistant starch and fermentable fibers. Fermentable fibers, matlab when you eat, it ferments there. You're not eating the fermented foods. The reason why I'm not immediately telling you to have fermented food is because a lot of you can be having histamine production, means allergies and itching. So if you start taking fermented vegetables and foods, and if you have fungal infection by any chance, you will come back and say this webinar was bullshit. Okay, so please don't have fermented food just like that. If your tolerance is good, please go ahead with it. But if your tolerance is not good, this is the last thing that I would start for anyone. Okay, so enjoy whole foods. Reduce the microbiome disruptors. Do not have anything which is ultra processed and packaged. Have something which is whole and real. Okay, limit unnecessary antibiotics, minimize the food additives, support the life rhythm by that is so important. If you are making changes only in the food, but if you're not changing your lifestyle patterns, it is a big problem, honestly speaking. If you're not sleeping on time, if you're watching TV all night and you are just waking up anytime and eating at random time, your body is not ready to break down the food now. Like any damn time you're just eating. And suppose if I'm doing this lecture and I'm having a breakfast together, so there's no point of having that meal because my body was so not ready. The enzymes, the stomach acids, all these things have not been improved. Okay, so spend time in the nature. Very, very important. Give different environments to your body. Now, people who are sensitive to different environments, don't do that immediately, please. You have to build your resilience. So I had one patient long back. I wish I knew this before. She was like sensitive to every damn food. Literally, she used to cry and she used to tell that I can eat only these many foods in my diet. And I used to feel so bad that I couldn't help her at that point of time because I didn't have this knowledge, unfortunately, and not many people knew about this. But at that time also I realized one thing. She was living in US, high stress life, and working, and also she had 3 dogs in her house, always having allergies. This woman always had allergies, menopause. Her microbiome would have been, you know, got affected 100%. Her tolerance for the animal exposure probably was very, very low, which was giving a constant allergy. I told her that, the more you live with your dogs, it is going to constantly give you sensitivities. Probably you have allergy issues coming from there, but how can she abandon them? Of course, that was a big problem. I asked her to see a functional doctor at that point of time. But today, if she comes to me, I will be working on these aspects for her. Even if she had a limited amount of food, I would still work on, one food at a time to increase her butyrate production, which was the biggest problem for her. I'm pretty sure on that. So a lot of environmental issues and factors will be affected. And I also saw her daughter having depression issues. Okay. So similar microbiome is somewhere in the family, something they are doing which is affecting their microbiome big time. Okay. So the resilience is going down eventually. So this is why every food has to be given intelligently to someone, not just bombard the patient with everything in one time. Okay. And also not to forget, it is important to work on the stomach acids and the enzymes also at the same time. Because if you have low stomach acid, the microbiome will have to fight back the pathogens even more. So it becomes a problem in itself. If you're not chewing your food properly, again a problem. You're just eating the food in big lumps and putting the pressure on the stomach and the other parts of the body. Okay. And also another thing, if your oral health is not good, okay, if you have too many cavities and too many other things going on in your mouth, okay, like in the sense like you use certain kinds of paste probably, or you probably are drinking water which is not good, like in the sense which is chlorinated water is also a problem. Like, all these things are changing the diversity in the mouth also. Okay, so all these factors will also affect the gut. Like, I had a history of cavities and I have done multiple times root canals. Okay, so all these things has also affected my gut. So even that becomes a problem in itself. Especially for people who have H. pylori infection in the stomach, I have seen that I will always ask them, how's your oral health? They will always come up and tell me that, oh, my mouth hygiene was not good and I had to undergo the cavity treatment and this and that. So these factors also we have to consider whenever we are working on the microbiome at the same time. Okay, so these are the pillars. So feed the microbiome, consume diverse plant fiber, resistant starch, polyphenol rich colors is what I'm talking about. Diversity is very important. Fruits, legumes, herbs, seeds, whole foods, adequate fiber, omega-3, and include resistant starch, fermentable fiber, and the whole foods. Okay, ultra processed foods and food additives, antibiotics has to be out, and good sleep, circadian rhythm, stress regulation. Very, 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 very important. Okay, so that's it. I am done for today's webinar. Now we are going to take some questions and answers. Thank you so much. It was a long one. A new topic for today. Now, questions. Let's see. Now, because it's a small group, probably I can take some questions. So Ritika has hypothyroid. Now, I hope you could understand, Ritika, what exactly is the gut issue. The SIBO is also suspected. That means you probably, your low stomach acid could be there 100% because it comes from there. Ask this biotic gut, that means overgrowth of certain pathogens could be there in your case, which is causing this kind of dysbiosis, which is giving you diarrhea kind of issues. Okay, so Ritika, that can be one major trigger. In a case like you, again, I will do the GI map testing. Nazia also has similar issues. Yeah, go ahead with your questions. What H. pylori test can I do? So if you just want to do that, you can do a urea breath test. That is the gold standard test that one can do for understanding the H. pylori. Second is the stool test, but I would not really say that. I couldn't find the urea breath test. There are the hospitals who can perform that for you. You will have to find around your place which one is available. So breath urea test is the gold standard that one can do for H. pylori. Okay. Stool test not always going to come accurate. Yes, but in GI map, it is also a stool test, but it uses qPCR as a test. So that is very, very quantitatively like small, and it can identify the things in a better way. So that's a different one. But yeah, if you just want H. pylori, probably that one. For oral health, what kind of toothpaste should be? I knew this question will come. So use a regular one. That's not a problem. You can use the Sensodyne and the fluoride one also. See, there are contradictory things here where people will say, some say chloride free and some say fluoride. I would say fluoride. If you're cavity prone, you need to use a little bit of fluoride for sure. Okay. Maintaining oral hygiene becomes very, very important. That is one thing. The use of antibiotics becomes very important here. And I also believe the water that we drink is a big problem. So it's no more a mineral water. It's not at all in mineral water, which is maintaining that beautiful trace element and homeostasis in the body. So the problem is not getting the right quality of even water, and also the soil that is got affected. So people who live in US, I sometimes give them some kind of trace elements so that they can balance that and also improve their epithelial cell conjunctions and the mucus layer, because you need trace elements for that also. So that brings a harmony. So what the body does is it will use the trace element in the way it wants, and then it starts working properly. So I do that only with the US patients. Why? Because the products are available there, but unfortunately in India it's not available. But yeah, maintain good oral hygiene. Try to not have cavities. That is so important. Floss properly, and after every food that you eat, just dry brush. Okay, that is very important. So my cousin is the dentist. I spoke to her that why do cavities happen. She's like, even if you brush 2 times, it doesn't really matter. That is not important. If it stays for more than 20 minutes in your teeth, it will start fermenting and start giving you cavity. So it's better to cleanse your mouth after every food, and brush, dry brush. So that is very important. I'm seeing this with my son. He is so small. He has got cavity in all four of his teeth. And I'm like shocked that how has that happened? I'm taking such good care. So one, he's a C-section born. I had an autoimmune condition myself. So maybe my gut was compromised at that point of time. His gut microbiome also was compromised. I'm pretty sure, because he's a C-sec born. He was on formula and breastfeeding both together, and he used to reject directly drinking from me, but I used to give him pumped milk through the bottle. Okay, so all those bacteria, maybe this, the milk lodges, and then probably he got that. So many factors are there. So it's not necessary. Even the doctor told me that it's not necessary that he had cavity because he was not cleansing his mouth after every feed. Not everybody does that. And there are so many kids who are not doing brushing for even 1 to 2 years. So they don't get it, but by this child. So I'm pretty sure it's coming from the history of my microbiome also. I'm pretty sure on that. And plus he's a C-sec born. I had diabetes also during my pregnancy. So many factors coming together. Okay, the beneficial ones were low for me, if at all. That also affected him. So all these together has affected his oral microbiome. So now I'm taking a very good care of his oral hygiene and giving him different foods and exposure so that his gut microbiome improves. I've started including a lot of fermented foods in a very early age for him. Like I am making fermented dahi made with the VSL capsule. So it's increasing the bifidobacteria and the lactobacillus in that. So I feed him that even if that he takes 2 spoons of that, because he'll get diarrhea, otherwise it's too small. So 1 or 2 spoons of that, I'm doing that, and different foods and different kinds of vegetables, and playing with animals, and also in the soil and the grass. I have started working on that. And as and when he grows, I'll give him fermented vegetables also. So that his resilience improves. No sugar, nothing like that. So all these things together, it matters. Okay. So raw vegetables causing floating stools. Okay, but experience no bloating. Chewing. Chew. If you see food particles here and there, it is normal, but chewing a lot of times is a problem for people. They're not chewing the things properly. If you chew it really well, then absolutely okay. It's not that raw vegetables are bad to eat. I have told people to have cooked vegetables and soups. That's because their gut is compromised. So don't have anything raw if your tolerance is poor. There's no problem. But if you're able to tolerate raw, nothing like it. Nothing like it. You can do that. But chew really well. Okay. GI map better for detecting H. pylori too. Absolutely. Yeah. Absolutely. I would do GI map. Like there's another, like I said, there are many tests. There's one more test which is very good for microbiome, but unfortunately it's not available in many of the places. Unfortunately, if it does, then I will start doing that instead of the GI map. Like it uses gunshot method of checking the stool and more sensitive than the qPCR. They are like, qPCR is also very outdated. Like it's the shotgun. So I would do that, like very, very resilient one. Is aloe vera working for gel-like production? One of them, yes. So mucus lining के लिए mucousy food also works very well. Like flaxseed forms a gel, chia seed forms a gel, apple pectin. एप्पल को अगर आप कुक करोगे पेक्टिन्स बनता है, सॉस जैसा बनता है. So apple is also there. Then bhindi is there, asparagus is there, aloe vera is one of them. So these are one of them. Okay, so you're just helping the mucus layer to form, because that is also kind of fiber only. But you have to give different kinds of fiber. Like you have to give resistant starch fiber. You have to give insoluble fiber coming from gourd vegetables. You have to give bitters coming from like Karela or cruciferous vegetables. So it has to come like different forms, colors in the vegetables, fruits also for that matter. Okay, all of them together, like one at a time. Don't do it all together, please. Pata chala bloating ho raha, and then people are like, "Ye kya ho gaya?" If new food introduction, even in small amounts, causes bloating, stomach pain, or any allergy, how how should we go about it? So, like I said, if somebody, now this is a complex thing, okay? This is where we professionals come as a treating part for the patient. So, if somebody is having food introduction and causes bloating and everything, first is that I will understand what is causing the pain for the patient and what is causing the allergy. What are the foods that is causing? And see, let's not blame everything on allergy. Many people don't have allergy; they have intolerance with food. These are two different things. Okay, if you have allergy, it is a serious thing. When you are allergic to something, body will not respond well to that particular food ever. Most of it's irreversible condition. Food intolerance it has built. That is a different thing. That is not coming from the allergy. It is intolerance. It is something sensitivity to certain foods. That's because again of the barrier that has been affected. So in such cases, I would do. I will support the stomach acids, maybe digestive enzymes. Is the bile good or not? We are going to support that first, and then slowly, I will start giving certain probiotics, which will not give so much of a fermentation kind of a problem. Like Saccharomyces boulardii is one of them, which doesn't give so much of a problem to people. Like I said, BSL-3 ko ferment karke dahi ke andar I will give that little to people. One spoon, one spoon, one spoon. That way I'll build up one food at a time. And if it is because even if you give one spoon, itna zyada bloating nahi hoga. So it will increase the tolerance slowly and steadily. And then I would probably give a spore biotic form of supplement, probiotic, so that it is not giving so much of a fermentation problem, like, gas problem. That can be given because it sometimes doesn't give bloating to people, spore forms. So that can be given and then slowly build up, the food part. That's how I will build it up. I will not directly jump into food directly. फूड तो मैं दूंगी, ऐसा नहीं है नहीं दूंगी, but I will give as per the tolerance of whatever the patient has told me. Slowly, I'll give one thing in one time. And if it is causing problem, make it half and then slowly build it up again. That's how I will work. It takes time, yeah. Like these are the things where I think you are a nutritionist, I think so, right? Uh, Vitamin D went down to 4 despite taking sunlight exposure and having clean eating. How many months will it take for me to reset the gut, and how I should go ahead about? Okay, so Nazia, also please understand if your vitamin D is also going low, okay, again and again, that means the dysbiotic gut is there for sure, because that is also very important to metabolize the vitamin D. And people will come up with low B12 and iron and D3 commonly. Okay, again, because of the stomach acids or the microbiome which is compromised, even after taking the sunlight exposure. So, how much time will it take for your gut to reset? There is no timeline for it. Okay, first is to understand what is actually the dysbiotic gut looking like for you. First is analyzing that. And then, based on that, slowly and steadily, we will be in a position to understand that, okay, how much is their tolerance, and slowly, once it increases, I think anyone who has gut or hormonal issue, give at least 9 months to 1 year at least for it to reset completely. You have to give that much time. That consistency in the lifestyle change and the food change and the supplementation, whatever you are taking, needs to be there to see a good improvement. That much time you have to give. Okay. The timeline can change for everyone, but it is not like 1 month you will be good. It all depends also on the history, how much of exposure of antibiotics and environment and everything that you're given.
So, ma'am, what kind
Lavanya,
of tests you recommend me to go about in this? Just a GI mapping?
gut issue, SIBO, bloating after meals. Yes, first, I see in your case again, I will do a GI mapping only for sure. Okay, that's one thing for sure. I don't know. Have the doctor told you have SIBO?
No, no, not the doctor. But the
Who said
conditions,
SIBO?
but the conditions which I am facing for a long time, it's
Okay,
indicating.
so okay. So a lot of people think they have SIBO on its own. Like yesterday also, I met one of the girls. She was like, I have SIBO, I have leaky gut, I have this. I said, okay, so where is the report and where did you see? No, 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 I know it's there. Okay, so it's not necessarily there. Probably you do not have enough bile flow, probably because of that. That is also causing the bloating issue, and that is why the vitamin D is also going low. Okay, that can be a thing. Now, such patients will not be able to tolerate little bit of fats also. Then we feel bloated after the meals. So that can be one of the symptom also. So the gut issue symptoms can just look very similar, and you will be questioning. Also, if there is the gram negative bacteria is producing a lot of toxins, will also give you bloating. Okay, and you will keep thinking, oh, I have low stomach acid. Probably it's not necessary. So yes, classically in your case, I would do all the basic blood work that is important, like all your insulin, sugars, and vitamins, vitals for your liver and kidney, and everything I will do. That is a basic one. Plus, I will do a GI map together to understand the condition and connect the dots and understand what is supposed to be done. I will do all of it. Okay.
Okay, thank you.
Now, no problem. Lavanya says, I suspect SIBO C4 and confirmed AMR2, but my dentist is giving antimicrobials. My oral health isn't. Yeah, probably, but you will have to take the medication for some time. I think you are the same person who connected with me on the DM. Is that so? Sorry, HAS. Sorry, HAS. I forgot your name. Yeah, so you will have to take the medication. So I'm not saying that you are totally against the medication. I'm not saying that medications are important for you to take. Sometimes you have to take it. You have to control certain kind of infections or anything like that. But the only problem is that you're not taking care of your immune system later, and if you're just continuing the lifestyle the way it is supposed to be, then it's a problem. Okay. Can apple pectin be? Oh yeah, I forgot this question. You mean this one gunshot whole genome sequence for gut? Yeah, gunshot one genome sequence. What is that? There can be. Yeah, I think there is this whole genome one also that they are doing, but it's which is this a test you're talking about? The name of the test, whole genome? Yeah, you are talking about the genome sequencing. I understand that. I think you're talking about the right thing. So yes, that is one method of understanding the microbiome in detail, which we can understand. Like if your body is making enough butyrate or acetate or kitna proportion ban raha hai, everything we can know about that. Yeah, if the doctor has confirmed CO, C4, nothing like it, then you know your diagnosis. And then can apple pectin be given to diabetics? Yes, you can give. I have given. See, honestly speaking, there is a strategy of doing things whenever you're working with a diabetic patient. It's not always like or you cannot have rice and potatoes and apples or fruits. There's a strategy and there's a way of balancing the blood sugars. If you're intelligent enough to balance that in the right way, for your, I think you are a nutritionist. I'm just considering that. That's why you're asking this. So yes, you can definitely balance that with some healthy fats and some kind of, some kind of healthy fats coming, like say chia seeds. Okay, you give a lot of chia seeds and then you add apple pectin for diabetic patients and then ask them to walk post that. It's not going to affect them. It will be good. It will be good. Okay. Yeah, that's the test name. Yeah, you're talking about the same one. You can, but in India it's not available. So if somebody's claiming that, I don't know what is it. In India, you can't. If you live abroad, that's a different thing. And only a doctor can suggest this, okay? Do you suggest doing any elimination diet, or we should just be working on the assets? Elimination diet is important in the initial time, but living and with an elimination diet is not okay. Are you getting it? You have to do elimination for some time. Definitely you have to. Like suppose, for example, this patient has intolerance with food and I'm, no, you have to eat for the resilience. This patient will run away. Like you don't have to do like that. You have to definitely do elimination and then build up slowly the tolerance. Okay. Any more questions? Any more questions? So if you have taken BSL-3 in the past and stopped working for you, nothing will work for you in the long run. You have to keep changing your diet and resilience also, ना? एक ही चीज पे तो आप काम नहीं कर सकते इतने दिन तक. Stop working for me, ऐसा नहीं होता. First is understanding what is your microbiome looking like, and it all you need different things for different things. Okay, it's not just one thing. एक resistant starch खाया तो मैं resistant starch ही खाती रहूंगी 10 साल तक. कुछ नहीं हुआ, ऐसा नहीं होता. You have to do different things for different things. I think you are the same one who did an HAS. What was your name? I forgot your name. This is not your real name. You're the same person who spoke to me the last time about the oral health and resistant medicines. You're the same person, I think. L-glutamine, zinc, carnosine, collagen, not effective. Like we can first begin to, despite having. I think you're working with a doctor, right? Already. What was your real name? This is not your real name, Lavanya. I forgot your name. I don't remember. Initially, it worked for me. No, glutamine, zinc, carnosine, collagen, not effective. Like we first begin with it, and despite of having SIBO signs, अरे ऐसा नहीं होता है कि ये effect नहीं दे रहा है. It takes time. Yes, it. What is it? It's against GMAP. Actually, I was shocked. See, if the doctor has advised not to go for GI map, it's fine because they now probably know the diagnosis. That is why it's not necessary that everybody is doing GI map. It's not necessary. Everyone has to do GI map. And it stopped working nahi hota hai. It is not like that. See, like I said, you have to eradicate the infection. You have to continuously take it. How do you know it is not effective? It takes time. You have to give 1 year time. You have just begun working with the things. Give some time, no? Okay. What are some signs to watch for in the body if a particular food is suiting me or not? The tolerance will be good. Simple. You eat the food and then you're not feeling bloated and you're feeling great. The best way to understand is the Bristol stool test is what I have started doing with my patients. I ask them stool test jo rehta hai. You can find that very easily online. So you can check your stool condition, like if it is type 1, type 2, type 3, type 4. How is your stool looking like? And also the symptoms, like do you have bloating or gas or anything like that? If that is not happening, that means the tolerance is great. Continue eating that. That's how you build tolerance. So I'll tell you, I have an example of one of my patients. Okay, she is like chronic anxiety and H. pylori is overgrown and she's like, suffering a lot. And this patient have to literally give her magnesium half capsule powder in the daytime, divide that into 2. That much sensitivity she has. Okay, that 1 spoon of curd also gives her anxiety. There is she cannot tolerate so many. Like I gave her an electrolyte, she started getting headache and anxiety attack with that. So it's like for some patients the tolerance is very poor. Now, when I gave her initially ginger juice with the meals, she used to bop like for 1 hour. Now it has improved. Her tolerance has improved after 20 days, little by little. Like it can take that long time for somebody to tolerate one thing. Slowly, you have to build it up. Okay. So that's how you will know the resilience has improved. Which brand has, you talk about magnesium capsule, right, Hemaji? Hemaji, you're talking about magnesium, right? MG matlab magnesium.
Yes.
Okay.
Yes,
Which
yes,
brand?
sir.
You can go for Vita 1.
Yes,
मैं
sir.
तो आपको बोलती हूँ Vita 1 है. It's pretty decent and good. You can definitely go for that.
It
But
is
एक
in
हाँ जी
powder.
बोलो.
I'm taking
Powder form. हाँ
it is
चलेगा.
in powder
Powder
form.
powder
Wait,
is always best.
no, but I want,
Powder is
I
best.
mean, I want a capsule form. I mean,
अच्छा. You
कौन
want
सा
हाँ
brand है
हाँ.
capsule
So
form?
capsule में there is Science of Good Health which makes in capsule form. Okay.
Okay.
साइंस ऑफ गुड हेल्थ. हाँ आप उसमें से ले सकते हो. उसका कैप्सूल फॉर्म में है. आई नो अ लॉट ऑफ पीपल फील सावर है, खट्टा है, इसलिए नहीं होता है कभी कभी टॉलरेट. सो यू कैन गो फॉर दैट. बट अगर आप मैग्नीशियम सिट्रेट ले रहे हो तो ही वैसा लगेगा. बट ग्लाइसिनेट में आई डोंट थिंक सो खट्टा बनाएगा. ठीक है. सो यू कैन टेक दैट वन, नो प्रॉब्लम. Okay, last one question, no problem. Glutamine, zinc, carnosine, collagen, and no effect is taken at start or initially. Like first we begin with it. Of course you have to go simultaneously with that because it's forming, it's helping you to soothe the gut lining. आपको कैसे पता चलेगा it is working for me or not working for you? It will take time. You will probably have to take it for at least 3 or 6 months so that कुछ तो improvement हो, and you have to build it up slowly. Okay, वो you will not understand if it is working for you or not. If it is working for you or not, initially some people feel bloated with the glutamine, the tolerance improves eventually. That's how. Otherwise, कुछ अंदर कुछ ठीक हो रहा है ऐसा कुछ feel नहीं होगा. You will not feel like that. Your tolerance with food has to improve. Your symptoms have to improve, and that happens only if your fungal infection will go down. That's it. So it's not like a sequence. Like first step I will do this, and second step I will do this. Every doctor, every nutritionist, any functional practitioner will have no sequence confirmation that this is how I'm going to work. It's totally dependent on their way of treating the patient. Okay, so yeah, it can be started initially. Why not? All right, any other questions? All right, I think no more questions, so I'll make a move. Thank you so much everybody for your time. I'll keep coming up with more such diverse. Did you like today's webinar, by the way? Thank you so much. Did you like